wife's name is Taylor and my name's Tony. And we live in Papua New Guinea, and Taylor was diagnosed with cervical cancer in March of this year. The cancer got to the stage where she had to have a hysterectomy to remove the cancer tumour from her body. It then proceeded to spread throughout her pelvic cavity. Now, we were treating it with natural medicine, and during the course of this there were some interruptions in the delivery of the medicine from Australia. So we had a scan in June and discovered the tumour had reoccurred in her pelvis and in the lower pelvis, and it was 5 centimetres by 4 centimetres. So we went to Australia and had it reassessed, and it had grown in 3 weeks to 8 centimetres by 6 centimetres. So we then proceeded to pursue alternate methods in preference to chemotherapy and irradiation, which would shorten Taylor's life and deplete her immune system. We did some research and found this hospital and were recommended by a natural clinic in Australia to come here. She had cervical cancer, and she was treated for the tumours in her lower spine, in her lower pelvic cavity. So she had one large tumour and she had several smaller tumours. So the doctors have treated that large tumour and it has receded. All Taylor's symptoms and pain and inability to eat and fever and everything have abated. They've gone. She still has a slight temperature sometimes, but that's only due to the absorption of the tumour, the dead tumour cells, dying tumour cells, and that gives her a temperature at some time. Since coming to this hospital, we have had outstanding results, as in Taylor had extreme pain in her lower back and her left leg, and was on heavy dose of morphine and 3 hourly painkillers. After the doctors did the procedure, 2 days after we arrived here, all the pain receded, and instantly the pain was gone. It not only receded, it vanished. And Taylor's been here now for 14 days and had no further pain from the actual cancer. She had a very limited bladder capacity because the tumour was sitting on it, and this tumour was very large. That tumour has since obviously withdrawn in size, and it has given her bladder capacity back, and she can now actually go to the toilet and function properly, whereas before that was a big problem. She's currently very fit, very healthy, and we are aware the cancer is still a possibility of it being alive, and we're coming back in 4 weeks to have it checked. But at this point, we are both very happy, and she's very happy, and we're very grateful. We're very grateful to these people. The service in this hospital is beyond reproach, and it's very daunting coming to a hospital in a country that doesn't speak the language, and we don't speak theirs. So the doctor's limited English was easily enough to follow, and the coordinators that coordinated our service and between Taylor and the doctors and her daily treatments, you couldn't ask for any better service. The people were most courteous, they were kind and understanding and did everything. They went beyond the call to the hospitals that we have in our country in Australia and the establishments in Papua New Guinea that they refer to as hospitals. This hospital has no question to answer for its service, either the staff or down to the cleaning staff, right to the cleaning staff. Everything's, you can't ask for anything. So there's nothing that can be improved here. And I've been in some of the best hospitals in Australia with my parents, and this hospital here is above them. If they're a 5-star hospital in Australia, our best hospitals, this is a 6-7-star hospital. So there is nothing that they can improve on it in my mind here. And the accessibility to the doctors. The accessibility to the doctors is unprecedented in our country. You do not have the access to the doctors that you have here. And that's very important to make sure that the patient has that contact and can ask those very possibly simple questions, but they're mind-settling questions when they have terminal cancer. So when you come here with terminal cancer, in Tyler's case, she wasn't going to have a long life, wherever she was treated. But here, we feel now that she's going to have a normal life. And with ongoing treatment here, she's going to have some more years, and then there's going to be advancements in cancer treatment. And when that advancements come, well, she'll just be eradicated from her body. So we're very confident that what's happened here, what's happened so quickly and so expediently, we can't ask for any more. We can't ask for a better result. So this hospital, I recommend it to anybody with anything that's wrong with them to come here first. As I've said before, we're very, very happy with the result. We're now going back to Australia on Friday, and we're travelling today to Jinan, then Shanghai tomorrow or tonight, and back here to Beijing, and flying back to Australia. And the next day we'll fly back to Papua New Guinea. She'll be resting for the next month, and then we'll be back here to have a checkup, and if we need any more treatment, that's what will happen. But we're very we're very proud and very happy, and we're very confident that what has happened here has been the ultimate that we could ask for. And I recommend that anybody that wants to come here, that thinks there's something wrong with them, they should come here. This hospital is working outside the box, and outside the box is what fixes people. Because cancer treatment in the Western world has a surefire result, and it's a short life. Whereas here we're hoping that this will extend Taylor's life to her natural lifetime, and she'll be fine. So many thanks. We were facing a very bad time before we came here, and we would have lost Taylor. So her future at this point in time looks very good, and we're confident, very confident, that a return here, and if we have to come back several times, it is irrelevant, because the treatment we feel is very successful.